Hello viewers, myself Sathgowda Patil, Assistant Professor at Department of Pharmacology, Kelly College of Pharmacy, Belgavi. So we are going to discuss about what is constipation, the treatment regarding the constipation, and what exactly the constipation meant to the patients, right? So what is a constipation? So this is not oftenly discussed and we always feel shy regarding this. So what exactly is the constipation? So it refers the bowel movements that are infrequent, means they are very less, okay, and they are very hard to pass. The patients which feel constipation have to strain a lot to evacuate their bowels, okay. And why this happen? This happens because the stool which is there, it is often dry and hard. So one reason, if it is hard and dry, the bowel movements will be very stiff in nature. The patient needs to strain a bit more, and due to that heavy straining or a forceful straining, the anal fissures may appear, and you may see some of the blood coming out of your stool, and you will be worrying that maybe these piles. No, sometimes the anal fissures may get confused regarding the piles. So this starts with the hard movement, that is hard evacuations, and excess time needed to pass the bowel movements, and pain in the bowel movements secondary to the straining. And along with this, due to the constipations and the hardenings of the stools, you may feel the slightly abdominal pain, and there may be also abdominal bloating. Along with this, you may also feel sometimes nauseous, and you may also vomit. So what are the particular causes for the constipation? So one reason is gastrointestinal disorders. Among that, the most causing one is IBS, that is irritable bowel syndrome. Then some of the neurological diseases such as a Parkinson disease, then multiple sclerosis, and some spinal lesions may also lead to the constipation. Then drugs which may lead to the constipations such as NSAIDs like opioids mainly, and antacids, and then calcium channel blockers. So what are the particular treatment which will give cure for constipations? So these are the drugs which helps in the evacuation of the bowels which were hard and dry, right? So these are different classifications. Let us see one by one. First is laxative. Laxatives, some are in milder action. What they do? They do elimination of the stools by making them soft. Okay. Then there are purgative, okay, which are stronger than the laxatives, okay, resulting in more fluidic evacuations. So when we look into the classifications, we see that first is bulk forming. These are like dietary fibers like bran, okay. Then plantago, then most common is Ispagula seeds, right? Then there is methyl cellulose. Then when we talk about stool softener, because the stools are very hard and dry, so these are liquid paraffins which are mainly used nowadays. Then there is stimulative purgatives in which is diphenyl methanes, okay? And there are anthraquinones like the seeds or the leaves called as sennas. Right? And there are fixed oils which will lubricate the harden of the stools. These are castor oils. And there are osmotic purgatives. One among them is magnesium salts, then sodium salts, and lactulose. Right? Then, so we have seen that what is the constipation exactly is. That is hardening of the stool. Okay. Then second, you may feel nauseous. Then there is abdominal pain, and there is a stomach bloating. Okay, and the patients try to strain themselves to evacuate the bowels. So we have seen the drugs which falls in a different various classifications such as laxatives and purgatives. So how does they work, or how does they give a relief from the constipation to a particular patient? Right. The first one is bulk forming, in which there are, we'll take an example, that is Ispagula. These are in various formulations such as granules, powders, or tablets. So what they will do, they retain the water in the intestinal lumen. Then since this is retaining the lumen, the water, what will happen? The bulk of the stool gives more pressure on the lumen. Okay. Now the stool was hard, right? Now what will happen? If the retention of the water is there, the stool automatically become softer and it will become little bit heavier. Then it will give the pressure on the lumen. So it will increase the peristaltic movement which is there, so that there will be easy evacuation of the bowels, right? Next, stool softness. Yes, as I said, the stools are very hard there, okay, and very dry. So stool softness, like a liquid paraffin is mostly used. What they will do? They will lubricate the intestinal wall which is there, so that increase the rate of passage of the gut contents. Okay, then reduce absorption of the water in the small intestine. Okay, so all this will lead to retain more water in the gut contents. Okay, ultimately what will happen? The stools are very dry. So what will happen? So water retention will continuously go on places there. So the stool will become softer. So softening of the stool will lead to the easy evacuations. Now, there's stimulant purgatives, which I told, like Senna. Then how do they work? So they are given in inactive form. They are not in active form. Okay. Then when it is administered, they get hydrolyzed in the GIT and it gets into the active form. What will do? It will cause GIT irritations. So since GIT irritation will happens, the increased permeability of the mucosal cells will takes place. So this will result in increase of fluid and electrolyte secretion in the GIT. So this will cause distension or pressure, which will lead to the evacuation of the soft stools. Okay. Next, and there are osmotic laxatives such as lactulose. So what are lactulose? These are the disaccharides of fructose and galactose that resist intestinal disaccharide activity. So what will do? When you take lactose, they metabolize by colonic bacteria into the short chain of fatty acids, then which will increase the osmotic effect or pressure and promotes evacuations. Now, when you talk about the home remedies which are often used, like we have seen plenty of fruits and vegetables which we can eat to cure the constipation, such as guava, then apple, kiwi, pear, spinach, and when it comes to the vegetables, we use cucumbers and carrot. So these are my references. Thank you.